the 61% basically represent the average country in this sample. The population of non-customers in that country indicated that affordability and cost was a key barrier to why they did not patronize a fitness facility.
This is All Things Fitness and Wellness, uniting industry thought leaders and fitfluencers on the mission to inspire innovation and encourage people to live a life fit and well. Today, we're exploring how fitness affordability could shape the future of public health and access to exercise. Joining me is Anton Severin, Vice President of Research at the Health and Fitness Association, to share insights from their latest report, Reversing the Physical Inactivity Crisis, Fitness Affordability as Strategic Policy. We'll dive into how reducing membership costs could increase physical activity, the broader economic and community benefits of better access, and what steps both policymakers and fitness operators can take to drive change. If affordability is one of the biggest barriers, how do we move the needle on making fitness accessible for everyone? Let's find out. But before we get to it, be sure to hit like and subscribe. We have new podcast episodes weekly featuring industry thought leaders and influencers. I'm your host, Krissy Vann, and this is ATFW. I am really thrilled to have Anton Severin here. At time of recording, we're wrapping up the month of January. We're gearing up for HFA in Vegas in March. And one of the things that we had at last year's IHRSA, now the Health and Fitness Association, was the rebranding of the organization. And I know along with that, there's been a little bit of shift in focus into what you want to accomplish. And something, of course, is having more research available to those in the halo industry to really advocate for ourselves as this preventative part of healthcare and this intersection of healthcare and health clubs. So Anton, first of all, thank you so much, because I know that you play a huge role in bringing this research to life.
Thanks for having me on, Krissy. Really appreciate it.
Now, one of the subject matters that we talk about endlessly here at ATFW with gym owners is the physical inactivity crisis. Every single conference that you go to throughout the year, everyone's trying to figure out how to attract that other 80%. Now we've seen some slight movement in the needle, that there's a few more coming in the doors. But the only way we're going to accomplish more bodies in the gym is understanding what the barriers are. And your latest research has really highlighted on a global scale how affordability plays a role. So first of all, for those that aren't familiar, tell me, what is the latest research that you published and what the overall scope is that's available for people to dive into?
So earlier this week, we released our price elasticity research that we've been working on for a couple of months here. So this really looks at, as you said, barriers to engaging with our industry for the large chunk of people in countries across the world who are currently not taking advantage of the benefits of structured exercise that we provide at scale. Yeah, this research really came about, driven by the pressing challenge that you mentioned there, like societies worldwide struggling with worsening public health trends, but also connected to that, right, is the rising healthcare costs and kind of the downstream negative societal effects that come from the inactivity crisis, right? So at the same time, we know that physical activity is a proven solution, and that professionally guided, evidence-based exercise, like the programs that are provided by our industry at scale, plays a critical role in reducing chronic disease risks, for example. So the key question then really became, like, how can we encourage more people to engage with the industry to help reverse this crisis? So we've seen from prior research that cost is often identified as an important barrier, but we know that affordability isn't something that the industry alone can solve for, right? Like, we know that many businesses operate on tight margins, making price reductions difficult without external support. Like, that would risk closures and really reduced access rather than expanded access, which is the opposite of what we need. So consequently, we know we need a support of governments and policymakers to address the question of affordability. But when we do engage with governments, it is not enough to highlight the health benefits of exercise. We really need to present a solid return on investment case. Policymakers need to hear hard data showing how greater affordability could lead to increased participation and the improved health and economic benefits that would flow from that. So that was the idea behind the research. We wanted to quantify that relationship, thereby helping make the case for policies like, for example, tax incentives to make structured exercise more accessible. Now, so it's really about government having a key role to play here, and producing the research that provides the evidence base to encourage them to act.
Yeah, you highlight it so well there because this is tremendously valuable information and necessary information. I've had the opportunity to join on a couple of occasions on Capitol Hill in the States to see industry participants advocate for the Personal Health Investment Today Act. And it is one of the most common questions that they get back. You generally never get to actually speak to the member of Congress directly. It's normally someone that's below them that then has to present the case for you. And they do need these evidence-based questions because at the end of the day, everyone knows in their mind that exercise is a key to physical and mental well-being. But what they need to know in order to move this forward is it going to save money? Where is it going to move the needle? It ultimately does come down to dollars and cents. So let's get into some of this research because it is so crucial for the industry. And I want to highlight before we dive in that if you are looking at these HFA reports, they have divided it up by country. I'm based in Canada. So similarly, we have a tax line that our Fitness Industry Council of Canada has been trying to move the needle on. So this is value information for not just the US market, but your research shows that cost, obviously a significant barrier, coming in at 61% of non-customers saying that it is a barrier. So what surprised you most about the impact of affordability on access to fitness facilities? Was this number surprising?
So going into the product, we certainly had a hypothesis, right, that fitness and exercise products are, like really nearly every product or services known to man, somewhat price elastic, right? Meaning that if prices go up, demand goes down, and vice versa. So while we had observed some of this in previous research, HFA does annual surveys around motivations for engaging or not engaging with industry, both in the US and in other places, and costs consistently comes up as one of the leading barriers to entry, right? So while we knew that going in, I was somewhat surprised to see that how it consistently ranked as a top 3 barrier or obstacle in all of the 10 markets we surveyed. So we included in the service countries in both North America, in Europe, in Middle East, and across Asia Pacific, and consistently cost was right up there as one of the leading barriers, in many cases surpassing even other commonly cited challenges like time availability, convenience, or gym intimidation. So, the 61% basically represent the average country in this sample. The population of non-customers in that country indicated that affordability and cost was a key barrier to why they did not patronize a fitness facility. The exact percentages ranged, from a low of 45% in, I think it was Spain, up to above 70% in Australia, but yeah, on average, it was 61% of respondents who indicated this as a leading barrier.
I actually found that quite surprising as well when you look at what typically are the things that stop individuals, and mainly because we know that there's fitness facilities generally on every corner of wherever you're joining us and wherever you live. And there's tends to be a wide variety from low cost, high value gym to the luxury sphere. And those HVLP models seem to be so accessible. So I wonder if it's a perception cost issue, like if the people actually took the time to take the tour and learn, or the sins of gyms past where people thought it was so difficult once you're tied in a contract and they're going to take all your money. Those are just curious questions, but I'm like, this information is
Yeah.
so valuable for how they put their perception out there because truthfully, the ultimate goal is to just get people moving in general. But when you look at HVLPs, it is not much of the bottom line for most individuals. They are probably spending more in DoorDash fees than they would for those gym memberships in the month. But that's my 2 cents, which I'm allowed to do. You're the researcher, so we'll keep you to the science. And on that note of the science, I actually loved this statistic. And again, this is just an average, obviously, because you did poll a bunch of countries, but that fitness facility customers are 56% more likely than non-customers to meet the WHO, so World Health Organization's activity guidelines. It shows what we do in our doors work. So how did your team arrive at the finding, and what does it reveal about the value of structured exercise?
In order to make the connection, right, that not only is the imperative there to increase physical activity, but also that our industry really has the potential to act as a key facilitator of this, right? We needed to prove that there is a significant difference in activity levels between those who engage, who are customers, patronize our facilities, and those who are not, right? So as part of the survey we did, we surveyed over 11,000 people across these 10 countries. We asked these adults to report their exercise frequency, exercise duration, and intensity to calculate MET minutes, so metabolic equivalent minutes, and assess activity levels against WHO guidelines, which is similar guidelines to what's used in the US and in Canada. And we then categorized respondents into fitness facility customers, so those who had a membership or package or class in the past month, and contrasted them with non-customers. So the results, as you say, were striking. So looking at the entire sample of 11,000 respondents, about 8 in 10 gym customers did meet the recommended activity levels, compared to just over 50% of non-customers. So while that gap certainly varied between countries, gym memberships were on average, 56% more likely to meet recommended activity levels. So, this really underscores the unique role of structured exercise environments. So gym offers more than just equipment, right? They provide accountability, community, and motivation, which are really difficult to replicate outside a dedicated fitness setting. And so the hope is here that for policymakers, these findings will highlight that facilities are not just commercial enterprises, but are really essential public health resources that help individuals achieve and sustain active and healthy lifestyles.
So we know that there is the evidence there through this research that what is happening in the gym walls works. And we also know from the first question that cost is the barrier. So it may have some health club owners, gym owners thinking, well, what is the magic number? How do we move this needle? And luckily, you looked into that as well. So your study demonstrates that a 10% reduction in membership fees could significantly increase participation. So can you walk us through, because the whole part of the study was about this elasticity of costs. So how was that calculated, and what might that mean for the industry? Because it sounds like a strong potential. And I don't want to take the answer for you, but I think of it on two fronts. We're fighting for incentives. So could that make up the 10%? Does it necessarily have to come out of the gym owner's pocket? Walk me through it.
Yeah, so in order to calculate price elasticity, we asked those non-customers who we had identified as being price elastic, meaning they had indicated a cost as being a top 3 barrier to why they choose to not be customers. And we asked them about their willingness to join at varying price points, starting with a typical membership price for a standard fitness facility product. So, for example, in your home country of Canada, we had 62% of adult non-customers in urban areas, which is an estimated 10.9 million adults, identify cost as a primary reason, as a primary barrier. So among these individuals, we tested the willingness to join at these different levels of price reduction. And the results showed that up to 2.5 million Canadians could be motivated to join with a 10% discount. Now, we also tested it at larger discount levels. And while they could theoretically attract more customers, the data does suggest diminishing returns beyond that sort of sweet spot of 10% discount. So I would stress, though, that while this figure represents a theoretical outcome based on stated intent in a kind of hypothetical scenario, even a smaller share of conversions could, translate into hundreds of thousands of new members experiencing the benefits of structured exercise.
Yeah, that 10% sounds like it could generate quite a positive ROI, obviously from the business side, and to the overall thing that we're all trying to hack. How do we get more people moving? We know that anyone that's walked into a gym and had the benefits of what structured exercise offers, it's contagious. So I feel like if we get a few more, even the ripple effect can be so outstanding. But your findings on the price point here suggest that women are particularly responsive to price reductions. So, did your research uncover why this group experiences higher barriers and what opportunities does this create for fitness businesses?
So in some of the countries, but not all, we observe these interesting differences in receptiveness to price discounts between certain demographics. So between genders or between income groups. So for example, the survey results for the US showed a larger impact from price reductions for lower income groups compared to middle or higher groups, which is not too surprising. But then we also saw in some countries, like including in Canada, a larger impact from price reductions for women relative to men. Now, exactly why that is unfortunately a question that goes beyond the scope of this research. But still, what it does do is emphasize the importance of affordability as a lever for expanded access, particularly for underserved populations, right, who may, for one reason or another, face greater barriers to participation than others. But more research is needed there to establish exactly what those reasons might be.
You just kind of have me thinking there because obviously you did look at numerous countries. Did they all kind of follow the same pattern, or were there any outliers that you found surprising in some of the research?
That was certainly one of the striking takeaways from the research, like how consistent the trends and the
Mm.
themes were across all of these 10 countries. So in all of the 10 countries, we saw cost being identified as as a leading barrier to entry. Across all countries, we saw that the likelihood of meeting recommended physical activity guidelines were about 50% higher in amongst consumers versus non-consumers. It differed slightly for sure. Like European countries tended to have a slightly smaller delta between customers and non-customers, but by and large, the trends were the same. And similarly, when we did the price elasticity analysis, 10% really emerged as the sweet spot, with around 14% of those price elastic non-consumers indicating a willingness to join at that 10% discount level.
I find that just really interesting because I know it's like each one of these countries has this version of what they are advocating for in regards to government policy. And we're basically championing the same message. And so I'm sure anyone listening is realizing, again, this research is so valuable. Now you have it evidence based. And if we're all championing the same message collectively and getting louder and louder, because that, I mean, we don't need to go into pandemic years, but it's kind of where we lost out when there were organizations like the restaurant industry and things like that were able to lobby so well because they
Yeah.
were so banded together. So I'm like, the fact that this research has such a steady theme throughout, tremendous
Yeah.
opportunity here.
I think that's a very strong point. Our research, that's certainly the goal. The goal of that I have is that it will ensure that going forward, the fitness industry do have a seat at the table, and that we will be part of shaping policy instead of reacting to it. But it's important to stress, right, that the work is only possible with the support of our members, right? So by investing in research, the industry is really investing in the future, right? Ensuring that fitness is recognized not just as a consumer service, but really as an essential public health solution that delivers measurable returns to society.
Yeah, well, and that kind of just leads in perfectly because I know the research and the report highlights those societal benefits, health savings, improved life satisfaction, community trust. So, what are some of the key data points that were found from your modeling that gym owners might find compelling in regards to those societal benefits that we know are crucial to our overall well being?
Yeah. So for this part of the research, we partnered with a global consulting firm, Portis Consultancy, and so they've developed a proprietary model to measure this so-called social return on investment, right? And using that model, we could estimate that a 10% price reduction across all these 10 markets that were covered in the study has the potential to generate up to $5.9 billion US dollars in direct health cost savings and an additional $12.1 billion in productivity gains, right? So again, that is the total for the combined 10 markets. Again, we can go back and look at Canada as an example here. In the case of Canada, the 10% reduction could as I said, motivate around 2.5 or up to 2.5 million new customers. That in turn could help prevent somewhere around 77,000 disease cases annually, and help avoid more than 500 premature deaths each year. And further down the funnel, we saw that these improved health outcomes could in turn translate into about 1.4 billion Canadian dollars in annual health savings. And in addition to that, right, we also looked at things like perceived well-being and community trust, and for those metrics, we saw that we could achieve somewhere around 400,000 Canadians that could experience improved life satisfaction, and almost as many that could experience enhanced community trust.
Wow.
So
And
so the impacts are really broad across all dimensions, health, economic, and societal, and so that was really like interesting findings of the research.
yeah, well, and I mean that societal component is so much of what's being pushed now, even just from a consumer driven marketing narrative. And I think it is so smart. I've talked about it a million times, but with the Surgeon General declaring the loneliness epidemic and the ripple effect of the fact that we don't have third spaces. And so this is just such a natural solution that we already have the structure in place. But again, it's just that recognition and support and reducing the barriers to get more people in the door. I know you touched on it there, but there is a huge economic advantage here if we get more people moving. 1.7 billion in additional consumer spending, 81,000 new jobs from price reductions. Can you talk more economically how it may benefit countries? And again, was this something that was consistent among the countries, or are there some that have more to gain from getting more people in the door?
Yeah, so this really ties back into the importance of bringing data-backed arguments into your conversations with policymakers and government officials, right? Like, these numbers are really key. So the numbers that you cited there are from again the Canadian specific analysis. The numbers certainly varied between the countries. Some countries, like the US, had an exponentially larger or could see an exponentially larger impact. But taking the Canadian example, economically, the potential for increased participation that could come from a 10% reduction could generate an estimated $1.7 Canadian dollars in additional consumer spending. So that is direct expenditure from new consumers, which was calculated based on reported spending patterns of current consumers. But also, right, like it could create up to 81 or more than 81,000 jobs. So that is both direct jobs within the health and fitness facilities, but as well as indirect employment in supporting industries that would be created by these new customers. So by lowering barriers to entry here. Governments, again, have an opportunity to not only boost physical activity levels, but also to generate broader economic benefits, right, including job creation and increase productivity. We talked earlier about the productivity gains that could be stem from this. So it's really a reminder that the fitness industry is deeply interconnected with both local and national economies, right? So it should really make us a powerful ally in driving both public health as well as economic development.
Do you happen to recall where some of those US numbers were lying on that front? Especially, I mean, even we can take a pause if you happen to have it handy, because I am just curious.
Um,
Obviously, it's just such a huge market, so I imagine it's an impressive number. Not to downplay
yes.
us over here in little Canada, but
So yeah, so in the U.S. case, similarly, we could see that this 10% reduction could translate into an economic opportunity of around 12.3 billion US dollars annually, as well as creating more than 200,000 new jobs, indirect as well as directly.
wow. So we're talking huge numbers, and those are the ones, to your point, entering that conversation, that are the ones that are going to give us the best potential to actually move the needle in regards to these policies. So, as we kind of round out the conversation here, if your research recommendations were fully implemented, what would the future of the fitness industry look like? And I mean, I get that your research, data based, science based, but give me the hypothesis there of how it could transform communities globally.
Sure. So yeah, if governments were to facilitate even a modest price reduction for fitness services, the potential impact could be significant, if not transformative, right? So not just for the industry, but for public health, economies, and communities around the world. So the data that we've produced here suggests that increased affordability could bring millions of new participants into structured exercise, which would, as we've seen here, improve physical activity levels and drive better health outcomes. Like that said, it is important to recognize that this is a theoretical outcome based on price elasticity modeling. But while the findings provide a compelling case for policy action, they do reflect right stated intent in a hypothetical scenario, and do not necessarily account for other variables such as behavioral barriers, consumer habits, or market conditions. But as we talked about before, like even a somewhat lesser shift in behaviors from this could still have very significant impacts. So even if only a portion of the projected impact materialize, the benefits would still be substantial, with lower rates of chronic disease, reduced healthcare costs, and stronger and more resilient industry as well. And who knows, at a community level in this scenario, you could see fitness facilities increasingly become positioned as vital public health hubs, helping people of all backgrounds access the life-changing benefits of structured exercise. So I think the opportunity is really there. It's now a question of whether governments and policymakers choose to act on the evidence.
Yeah, without question. I know that obviously this research was months in the making to put together before it's actually released. Are you able to share anything that you are working on in 2025 that the industry can look forward to not only consuming, but to your point earlier, that helps reiterate why supporting HFA, for example, is so beneficial to the industry as a whole?
Yeah. So I think you can broadly divide our research into two buckets, right? Like one that's more geared towards operationally, guiding individual businesses in their decision making by providing, benchmarking tools and insights into consumer behaviors. That will certainly continue. But as we move forward, we will certainly, lean heavier into the sort of research that help inform our advocacy efforts as well, thereby, strengthening our ability to speak on behalf of the industry to policymakers in Washington as well as in in states around this country and as well as capitals around the world.
Brilliant. Well, Anton, I know that you're coming off a busy week having just put this research out publicly, and I just so appreciate that you were able to carve the time out here at ATFW, and I look forward to learning more from you as the year progresses. I really appreciate your time.
It was a pleasure to be here. Thank you, Krissy.
You've just listened to the All Things Fitness and Wellness podcast, hosted by Krissy Vann. Be sure to hit like and subscribe. We have new podcast episodes weekly featuring industry insiders and influencers. Together, we're on a mission for everyone to live a life fit and well.